So now we're going to pivot from the NIH to focus on Katie Schubert, who's the president and CEO of the Society for Women's Health Research. Katie, please join us.
Thank you so much, and thank you for including me and the Society in this effort. I think there are a lot of really important opportunities here when we think about research and funding needs. I think the short answer is we need more. I think we all realize that, over the last 2 days, but also over decades. Just to start, SWHR was founded over 30 years ago on the idea that women weren't included in research. And we promote research on biological sex differences in disease and women's health through science, policy, and education. Before I was at SWHR, I was at the Society for Maternal Fetal Medicine, working on maternal mortality and morbidity on the policy side of things, and talking a lot about the need for additional research as well. And I think ultimately, again, there's a great need for increased, focused, and cross-agency research, which is going to require significant resources to really increase the knowledge and improve maternal health outcomes. Next slide, please. So when we think about opportunities and threats or challenges, I think to this, a sort of starting place would be that the majority of research funding and investment in maternal health is at the federal government level. And Dr. Chin just did a great job of talking about the NICHD. And I'm going to talk a little bit more about where there may be some opportunities at the federal level. But ultimately, when you think about this space, there's not a lot of incentive for private investment or industry to do this work. It's often seen as pregnancy as a short-term period. It's not a disease, right? It's a life stage. It's a physical, biological process. But ultimately, it's not actually short-term, and it really does impact, the rest of your life. And if you think about this sort of across the lifespan, I think there's opportunity and need to really work together to make sure that there's a multifaceted approach to this. And I think a combination of some of the coverage, access, cultural, and societal support that we've heard a lot about over the last couple of days, alongside an investment in research, can change the tide here. Next slide, please. So I pulled just a really quick, and this is a non-scientific chart from the NIH reporter system. I just put in a search for maternal mortality funding for FY21. And what you can see is kind of, I think, what we expected, that largely that projects are being funded at the NICHD. And I think that's sort of important to note that that is truly the home at the NIH for this type of research. On the next slide, I put in a search for women's health, and if you click a couple of times through, you can see that the bulk of the projects are in women's health, funded at the NCI. You think about breast cancer, ovarian cancer, et cetera, the gynecologic cancers. And then the next institute that's funded is the NICHD. So it goes NCI, NICHD, followed by the NHLBI, so you get the cardiovascular work, NIDDK, NIDA, they have a very strong women's health and sex differences program there, NIMH, and then it kind of goes down from there. So as we're honing in on women's health broadly, there's a lot of different opportunities throughout the NIH institutes, as well as the CDC, FDA, ARC, you can see there as well. Next slide, please. So I wanted to take a moment, because I do think that we think of this research, the home is, as I mentioned, at the NICHD. And we as a community were really excited when the NICHD had its strategic planning process, and its mission and vision were that NICHD leads research and training to understand human development, improve reproductive health, enhance the lives of children and adolescents, and optimize abilities for all, with the vision of healthy pregnancies, healthy children, healthy and optimal lives. There is also the Office of Research in Women's Health at the NIH, which is not an institute, but it is the first public health service office dedicated specifically to promote women's health research within and beyond the NIH scientific community. So you're seeing some coordination from that office across the institutes. But again, the investment there on the maternal health side is really truly at the NICHD. And I pulled a little bit of data that Dr. Bianchi at the NICHD had presented during that strategic planning process. So in fiscal year 2017, the NICHD was funded at $1.37 billion. Of that, 14% went toward pregnancy and maternal research. I would juxtapose that with 55% for pediatrics. So obviously we would want to see, and there is some overlap, obviously, when you look at neonatal outcomes. But when you think about it, that's a pretty stark difference between investments, and then 15% for gynecologic and reproductive, 18% for intellectual, developmental learning and physical disabilities, and 7% for other, which includes some of their rehabilitation work. When you look at pregnancy and maternal health, the research portfolio by condition, and Dr. Chin mentioned this, most of that went to preeclampsia, but then it went to obesity, gestational diabetes, and depression. And again, that's in fiscal year 2017. So this is all pre-COVID. And then when you look at pregnancy and maternal health research by broad scientific domain, most of that went toward basic research and then behavioral interventions, population, biomedical interventions, and screening and diagnosis. So just some level setting there in terms of where that money has been traditionally going, with a larger investment, I would say, in the last few years since that data was pulled to maternal health. Next slide, please. So overall, I think there's a lot of need in terms of how to reduce these barriers to inclusion. Women historically were excluded from clinical research, even into the 1990s. That's why SWHR was founded. That's why the Office of Research on Women's Health exists. And I feel like we've done a pretty good job of raising those levels of participation of women. However, it is lagging behind, and we saw a huge light shown on this during COVID, in particular in the vaccine trials and data collection efforts surrounding subpopulations of women and those historically excluded populations, racial and ethnic minorities. And I would even go so far as to say, and we've talked a lot about this, historically exploited populations are not included. There's a lot of reasons for it, and that the overall population is not reflected in the research that's happening. And so that really should be a goal of where we're investing and what our priorities should be when it comes to this type of work. I wanted to take one other moment to talk a little bit about in the inclusion of pregnant and lactating individuals in research. Also housed at the NICHD is the PregLac Task Force, which was created by the 21st Century Cures Act, on the idea that pregnancy and lactation is sort of what I call the third rail of research. There's a lot of questions surrounding that. However, we really truly need to remove those barriers to be able to learn more information about how to improve outcomes, not just for mom and baby, but also when you're thinking about women's health across the lifespan and what's going to happen later on. We talk about transitions of care a lot. I've heard several people mention that today, that postpartum time period really being a crucial time, but it's really far beyond that as well. So ultimately, what this idea is that we're moving, or would like to move, from a culture of inclusion rather than a culture of exclusion. We're really looking it's going to take an acknowledgement of structural racism. It's going to take serious work to build trust and to create models where people feel safe and willing to participate in research. And I think it's not just necessarily inclusion or recruitment, it's really active participation in that research. So those are really critical areas that need to be acknowledged and addressed in order to move forward and move the needle. Next slide, please. So in terms of advocacy efforts, you just heard a lot about these, as far back as 2018 and before that even. The Preventing Maternal Deaths Act passed. This was in order to stand up maternal mortality review committees. There was money included in that legislation to create standardized data collection efforts. However, it certainly wasn't enough to stand up, these standard MMRCs throughout all states. You heard a lot about the Black Maternal Health Momnibus that has been introduced the last couple of Congresses. This is tremendously helpful. It's really focused on the social determinants of health. It's looking at implicit bias training and building back into medical training, which we also just heard about, just in terms of making sure that there is thoughtful consideration of cultural differences, of making sure that there's diversity in the perinatal workforce. It addresses maternal mental health. It addresses investment in digital tools, innovative payment models, COVID-19, maternal vaccination, et cetera. And then there's this idea of continuous Medicaid coverage for a year postpartum. And someone stated earlier today that postpartum is forever, and I couldn't agree more with that. It really is something that resonated with me, and it's something that we need to be thinking about when we think about investment in research. It's not just for better maternal health outcomes during that period of time in a person's life when they are of childbearing age. It will improve outcomes for a woman's life across the lifespan. It can also inform, maternal health going into it prior to pregnancy. So it's really critical when you think about sort of a large scale effort related to maternal health, that it's comprehensive. All of this is to say that there has been a lot of conversation. There's been some investment. It is very encouraging, but again, it's just not enough. We've done a lot on the data collection and public health side. It's kind of piecemeal, and I think we're working our way up to make sure that it's kind of coming together. And it's not as coordinated or inclusive of sort of the research dollars at NIH or even across agencies in a really robust way that I think we probably need in order to address these issues. Next slide, please. And so in conclusion, I have a lot of concluding points here, but what we really need is an increased and sustained investment in research that will optimize health and outcomes. And this is not just for fetal outcomes, it is also for maternal outcomes, again, across the lifespan. We need basic translational and clinical research, as well as public health services and policy research and implementation science. If we really truly want to impact maternal mortality and address this through an equity lens, we need to invest in research in women's health throughout the lifespan. And it needs to be multifaceted. We have to look at conditions, diseases, life stages, all of this, again, in the future, and how your growth and development might impact that. We need to look at life transitions and those transitions on and off of coverage. Someone mentioned electronic medical records. This is a huge area of need just in terms of continuation of care and records. We need to look across health data systems and settings. It must be patient-centered, otherwise it's not going to work. And we have to ensure the inclusion of pregnant and lactating individuals in trial design from the beginning. And again, ultimately, trial populations need to reflect the treatment population. And I think my personal call to action is a comprehensive, collaborative, large-scale initiative that really provides significant investment to tackle these issues, because without that, we're going to make some progress. But I think ultimately, women need to be valued and prioritized in this country to be able to move forward and address the maternal mortality crisis. Thank you.